Hello everyone, my name is Blessing Wanki and my nursing issue I'll be talking about today is 12-hour shifts. Just a little background information. As we all know, 12-hour shifts, means, you're at work for at least 12 hours a day, which as nurses, we know that never happens. It's at least, 30 minutes after, your scheduled time, because we are required to give report and other things that have to get done before we leave work. 12-hour shifts came about due to the nursing shortage that the country had, and 12-hour shift was implemented because it required less staff, meaning only two shifts had to be staffed, and hospitals with 12-hour shifts, hospitals needed less staff. Okay, why is it an issue? It's an issue because some nurses prefer working 12 hours while others do not. You know, um, it improves nurses' work life, for those who like it. But, others, prefer working shorter shifts, which, requires them to work more days. Um, it it affects staff's well-being and patient outcomes. I'm gonna talk about some of the pros of 12-hour shifts, the good things about it. 12-hour shifts entail two shift changes in a day instead of three, which accounts for better continuity of care for patients. Continuity of care brings about good outcomes because nurses are already familiar with their patients and know what to expect. By only handing off report to one shift, it helps reduce communication errors that can occur if report has to be given to several shifts. Nurses who work 12-hour shifts usually work 3 days a week. That means having 4 days off is a plus. On nurses' days off, they can recuperate, have a personal life, family time, and lots more. Nurses can even volunteer with their time off. Fitness is another area. It's another area nurses can take advantage of on their days off. A study conducted at the University of Pennsylvania School of Nursing brought about a large majority of nurses to be satisfied with 12-hour shifts because it cuts down the number of work days. The flexibility of working 12-hour shifts can be great. Nurses can further their education by attending school part-time, which is what some of us are doing, travel without having to request time off, and rest, which is, I feel, the most important. Some nurses who live in big cities or nurses who live in the country who have to commute to work can take advantage of 12-hour shifts because it saves them on travel costs. 12-hour shifts, saves on hospital costs. Nurses working longer shifts help nurses use the extra money on other things that the hospital might need, like equipment. The next I'm going to talk about is other cons of 12-hour shifts. 12-hour shifts can be a problem when it comes to patient safety. A study was conducted and results were risks to patient safety and increased significantly when nurses work 12 hours or more. Nurses' critical thinking and judgment tends to decline towards the end of their long shifts, which could cause accidents and errors on patients. The chances of making an error increases significantly due to tiredness. A study of 663 nurses at 71 acute care hospitals in Illinois and North Carolina showed patient deaths from pneumonia and acute myocardial infarctions occur more often in hospitals where nurses work long hours. Nurses feel physically exhausted after their 12-hour shifts. They are at greater risk for sharps and needle stick injuries towards the end of their 12-hour shifts due to tiredness. 12-hour shifts that end up being 16-hour shifts, 16-hour days is a problem as we all know or might have experienced in the past. The level of fatigue that some nurses may experience is not safe for both the patients and the nurses themselves. On the days that nurses need to cover, sorry about that, on the days that nurses need to cover their 12-hour shifts, it is noticed that nothing else can be done on that day. The time it takes to drive to and from work, sleeping, and taking care of personal responsibility can be hard to manage when most of one's day is spent at work. A study conducted at the University of Pennsylvania reported that patients complained of nurses being less responsive to their needs towards the end of their long shifts. Nurses who work long hours are putting their health at risk. Drowsiness does not only affect the nurse, it affects the patient. Working long hours can negatively impact the way some nurses work and can cause them to overlook important health and safety risks. Working long days can cause stress upon nurses, which could make them at risk for illness. Stress can cause nurses to request more time off from work than they usually do. Due to fatigue and tiredness, forgetting something important can be deadly to a patient, which could have been avoided if the nurse was more alert. A study conducted found that nurses working 12-hour shifts had 13% higher rates of care left undone than those working just 8-hour shifts. So, when it comes to my opinion on 12-hour shifts, I think, this is a very interesting topic to debate on. I feel one's age matters tremendously when it comes to working long hours. As a young nurse in age, I sometimes get exhausted during my 12-hour shifts. The level of throbbing pain my feet goes through can sometimes be unbearable. Sometimes I can't imagine my co-workers and counterparts who are in like their late 50s or maybe 60s, who are who are experiencing the same thing I'm experiencing. Mostly the younger generation of nurses do not see 12-hour shifts as a problem compared to their counterparts, which are the old school nurses. I've never really seen or heard of most, nurses my age group complain about the length. We actually enjoy it because we spend less days at work. I feel to survive those long shifts, one needs to be physically fit, which is not always the case. We know how unhealthy some nurses are due to the fact that they don't have time to do anything else. Nurses need to take care of their health to provide the quality of care they are obligated to do once they show up for work. Nurses need to take breaks to have a snack, drink water, or simply go to the bathroom, which is vital to survive. I always make sure I do that, because tiredness is real. It is nice to have extra days off from work as compared to white collar jobs. I enjoy working 12 hours just because of the flexibility I have. I have a social life out of work, which I enjoy. All right, the issue of 12-hour shift personally, personally, the only issue I see is just the exhaustion and, and sometimes not being able to get enough breaks, or rest, throughout the day. Nationally, the issue I see is the nurses burnout rate. A lot of nurses, just get tired, and with the burnout rate, a lot of nurses tend to leave the profession due to the stress and other things. The solutions to to the issue of working 12-hour shifts is nurses need to take breaks during their shifts. They need to find time or make a way to take care of themselves, you know. Also, they need to limit the number of 12s they work in a row. You know, for example, we all know, you know, our bodies, ourselves, if, you know, after two 12s in a row, you know, you're physically and mentally exhausted. Nurses need to try, you know, if possible, to make sure, you know, they have a 1 day off after, you know, two 12s, you know, before working the third 12, instead of working 3 days in a row and the third day might ending up in a disaster. So basically nurses need to take care of themselves, and also rest is very important, you know. Nurses need to, on the days off, they need to rest, you know. What tends to happen is that nurses work more than one job, and on the days off they tend to work somewhere else, or they tend to work a lot of overtime, and that's a problem. And you know, if any of the solutions I mentioned does not work for, you know, the nurses, what they can do is they can find a job that have 12 that have 8-hour shifts, because there are jobs out there. Not all jobs only have 12-hour shifts. In conclusion, patients and nurses are at risk doing 12-hour shifts. Proper planning is essential to diminish this risk. You know, you got to plan ahead, you know, to make yourself successful, and minimize the number of shifts worked in a row. If working 3 days in a row it tends to be a problem, try to spread it out. And here are my references. Thank you very much.